So it's great that we've all been able to mix back with our families and friends again. So it's not unexpected that we're starting to see an increase again in our winter viruses. So this isn't just COVID, this is seasonal flu, respiratory syncytial virus, for example. We are seeing an increased number of admissions, but most people it's as an incidental finding rather than being admitted as a result of the COVID or the flu infection. So our main message is for people to be vigilant of the symptoms. Please continue to do your COVID testing, but if you're coming to visit your loved one in a hospital, even if you test negative and you've got a high temperature, for example, please don't come and visit your loved one until those symptoms have settled.
And are you satisfied where we are right now, Gibraltar, in terms of COVID or winter viruses, or is there a reason to be concerned or alarmed perhaps?
I think we've responded appropriately so far, because it's always going to be a balance to enable people to move back to living normal pre-COVID lives, whilst we see alerts coming out of China, for example, in terms of the increased transmission they've got there. We've just marginally stepped up our approach. We've introduced mask wearing at the hospital. We've introduced negative PCR testing for travellers coming from China. So we're in that phase of enhanced surveillance, and hopefully we'll be able to navigate this winter and step back those measures as we move through 2023.
Now, you did warn about this earlier at the tail end of the summer, I remember that. In terms of people and how they're interacting with each other, have we moved past the era of COVID, or are people still very COVID aware in terms of mask wearing, social distancing, personal hygiene? What do you think?
I think it varies. I think we've got two distinct groups. We've got the people who just wanted COVID to be over, who don't want to wear masks, and I understand that. We've also got a cohort of people who are still quite scared. And we do still see, walking around in the street, people wearing masks, for example. And I think we should respect those people who, for whatever reason, may choose to still wear a mask and be quite cautious, because they may have, for example, underlying health conditions, and there might be reason for them to be taking that cautious approach.
And here at the hospital continues to take precautions. We've heard of a number of wards closing over the Christmas period, reopening, and other ward closures.
So what we're trying to do is we're reviewing on a daily basis the hospital response to the increase in all winter infections. It's not just COVID, it's RSV, it's seasonal flu, it's COVID, it's Group A strep. So what we're doing is reviewing on a daily basis. We're trying to what we call cohorts, so that's group people together who've got infections. So Calpe ward, for example, tends to be the ward we use for people who are flu positive or COVID positive. But sometimes we may run out of beds on that ward, so we end up grouping people on other wards. Now what we're trying to do is keep visiting open on most wards for as long as we can for the majority of our patients. And that's why you might start seeing, certain wards for certain patients are closing. That's because we're having to group people together who've got a winter infection.